Hi, you guys. Welcome back for our daily practice questions. It is day 73. And as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the AMCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Reminder, my upcoming 5-week intensive review starts April 21st and runs through May 30th. You probably have seen the notifications. There are 2 spaces remaining. If you're looking to join, make sure you click the link to enroll. All right, you guys, question number one. A 32-year-old woman presents to your clinic with a complaint of recurrent headaches. She describes her headaches as being moderate to severe in intensity, usually starting on one side of her head and lasting from 4 to 72 hours. She reports that the pain is throbbing and often accompanied by nausea and photophobia. She mentions that these headaches tend to occur once or twice a month, and sometimes she experiences visual disturbances before the onset of the headaches. Based on her symptoms, what is the most likely diagnosis? Is it a tension type headache, B, a cluster headache, C, migraines without an aura, or D, migraine with an aura? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you, right? So here the stem of the question states, based on her symptoms, what is the most likely diagnosis? And y'all know what I always tell y'all. If they're asking for a diagnosis, you need to run it back and look at those assessment findings and determine what this diagnosis is based upon their presentation, their signs and symptoms, their chief complaint, things that are noted on exam. This is all those assessment findings, right? So this 32-year-old woman comes into the clinic complaining of recurrent headaches. She describes the headaches being moderate to severe. They're lasting anywhere from 4 to 72 hours. Throbbing pain associated with nausea and photophobia. She gets these headaches once or twice a month. Sometimes she has visual disturbances. Y'all, this is classic presentation of D, a migraine with an aura. Remember, migraines are unilateral, right? That's one of the headaches that are unilateral, but also with an aura are all of those things that are accompanied with this headache. So she's not just having just the unilateral headache. She's also having the nausea, the photophobia, the visual disturbances. That's how you know to classify it with an aura versus without, okay? All right, question number two. A 28-year-old woman with a history of frequent migraines presents to your clinic during a migraine attack. She describes her headaches as severe, unilateral, and pulsating with associated nausea and light sensitivity. She reports that her migraines usually last for several hours and she is unable to work or perform daily activities when she has one. She is looking for immediate relief to stop the headache. Which of the following is the most appropriate abortive therapy for this patient? Is it A, acetaminophen, B, ibuprofen, C, sumatriptan, or D, propranolol? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question here states, which of the following is the most appropriate abortive therapy for this patient? All right, so we're looking for treatment, right? What is the treatment? And I tell you, if they're asking you for a treatment, you need to run it back and see if they provided you with the diagnosis. If they have provided you with a diagnosis, then you can proceed forward, right? But in the event that they have not provided you with a diagnosis, then you need to run it back a step further and look at the assessment findings so that you're able to determine what the diagnosis is, right? Because we got to know what it is to be able to treat it. All right. So they told us that she has frequent migraines and she presents to the clinic during a migraine attack. She's also mentioning nausea, photophobia. So we know it's a migraine with an aura. But the key here in the stem of this question states, which of the following is the most appropriate abortive therapy, right? So abortive therapy, acute therapy for migraines is C, sumatriptan, right? We use triptans during acute phases. So if it says acute treatment or abortive therapy, think triptans. Don't get caught up, mixed up, and miss things because you're not paying attention to the type of therapy that they're asking in the stem. And also, even if they don't have it in the stem, pay attention to what they're telling you. Literally, in the question, it states that where is it? A 28-year-old woman with a history of frequent migraines presents to your clinic during a migraine attack. This is still letting you know this is acute, right? So pay attention to all of the details. All right, question number 3. A 40-year-old man presents to your clinic for management of his chronic migraines. He reports experiencing 4 to 5 migraines per month despite using over the counter or abortive medications such as ibuprofen. He is looking for a medication that can help prevent the migraines from occurring. What is the most appropriate prophylactic therapy to offer this patient? Is it A, topiramate? Is it B, sumatriptan? Is it C, naproxen? Or is it D, acetaminophen? Take a moment and tell me what you got, y'all. All right, so stem of the question here states, what is the most appropriate prophylactic therapy to offer this patient? All right, so again, has the diagnosis been provided, right? So in this event, yes, it has. Again, this is a patient with chronic migraines. And then the stem is also telling you prophylactic therapy, right? So again, pay attention to the terminology. The best answer is A, topiramate. Um, think about these things. Like I told you in question number 2, when we use acute therapy, abortive therapy, I want you to think your things like sumatriptan. The triptan is your first line of that, okay? Now there's other options, but again, those triptans are first line therapy when we're talking acute phases. When we're talking prophylactic treatment, you can use things such as your topiramate, your Elavils, your propranolol, things of that nature, because we're trying to prevent the headaches from occurring, right? Whereas if you look at these other answer choices, your sumatriptan, like I told you, is for abortive therapy. Naproxen is an NSAID, is also utilized for abortive therapy. Tylenol is also used for abortive therapy in most cases. Also, this question already told you that they're still having these issues despite over the counter abortive medications such as ibuprofen, naproxen, ibuprofen, same drug class, right? So pay attention to the details, okay? All right, you guys, I hope you found this helpful. We're continuing to work through all of our systems so that I can try to help navigate you through and prepare to take the knowledge that you have and apply it. So now as we're working into the neuro section, I want to make sure you have these headaches under control. So we'll be talking about more of the headaches in the next upcoming days. But I want you to, when you're thinking of migraines, know how they present. So that first question, as you can see, it was more so to help you be able to diagnose, understanding a migraine and its presentation, knowing that it's unilateral, knowing that it can have an aura or it may not have an aura, knowing how to differentiate between the two, and then knowing how to treat, thinking of those first line therapy options in abortive therapy cases versus prophylactic cases. Okay. So again, I hope you found it helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. And again, I appreciate you for those of you who have been sharing and sending the referrals. I think I'm gonna start periodically just drawing names or something. I gotta find a way to do it for those of you who have been sharing and doing all of the things. I can see and I'm getting the feedback from people. And so thank you, thank you, thank you. But I gotta find a way that I will do it in a time frame. I'll update y'all on that and give you like a free one-on-one session or whatever to show my appreciation. But anyway, y'all know if you need any of the resources that I do offer, I always say either call, text, or email the nursing studio. You can call us at 803-400-6864, or you can shoot a text message to that number, or shoot us an email to thenursingstudio, the number one, at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And as always, if you're looking to book any of my one-on-one sessions, question analysis sessions, or any of my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type, okay? All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.